How you doing? My name is Tyler Barnes. I'm a therapeutic recreation and leisure major from Alexandria, Louisiana. And today, this video will be talking about facilitation techniques. My facilitation technique that I chose to do was group therapy. The first step for group therapy is mentally and physically preparing yourself as a facilitator. Mentally preparing yourself involves getting to know your patient, making sure that you know what's going on with them, make sure that you will be attentive and show a certain type of care for what's going on with them. Physically preparing yourself involves your posture. Make sure you're sitting upright, make sure that you're sitting in front of them, make sure that they feel like you care, things of that nature. Number two is create the right environment. Make sure when you're talking to the patient that you're giving off a positive feedback. Once they feel like it's a positive feedback, they will eventually get comfortable with their environment, and it'll be easy for you to just be able to talk to them and find out what's wrong with them. Number three is establish expectations. When you're talking to your patient, make sure that you are giving them showing them what the outcome should be after you guys meeting. You want to just make sure that they know, make sure that they are working towards a certain goal. Make sure you guys are working towards a certain goal, both parties, the patient and the facilitator. Number four is engage in an exercise. Once you have sat down with your patient and talking to your patient, whatever activity that you have for them in the group therapy, make sure that they are being active with it. Make sure you're being active with it and showing that they're some type of interest in whatever the activity is, so they can show a certain type of activity level in the group. Number five is manage the participants. As these group activities are going on, make sure that you're going through the group activities, just scanning, just make sure that everybody's doing what they're supposed to do, and also find out the ones that's in the group therapy sessions, which ones are the quiet ones, which ones are not all the way comfortable with the environment. And with those, just make sure you give them little tasks so they can open up more and more. Once you do that, they will form a comfort level that will eventually help them in the long run with this group activity. Number six, as you go around and facilitate scanning, things of that nature, make sure you change up your style, your approach with these certain groups. Every group is not the same. Every patient is not the same. Make sure that when you're going through, kind of adjust yourself, how you talk, how you walk, how you just approaching the whole situation, because just your approach can go a long way with how they react to the group activity, to you, to opening up to their comfort level, to their environment, things of that nature. Number seven, once you're in the groups, just making sure that, like I said, picking out the ones that are having a tough time with the group activities, giving them small tasks, things of that nature. And number eight, to finish off, reflect. Whenever you're talking to the participants and the patients, make sure that you go back over the expectations of the group activity and see how far they've grown. Not every patient is going to meet the objective of what the group therapy was, but as long as they're working towards the positive way, that goes a long way as well. Just knowing that you changed something with them will give you confidence and them as well. And yeah, that's my presentation on group therapy as a facilitation technique in therapeutic recreation and leisure studies. Thank you.